Hello, I'm Audrey Tang, Taiwan's Digital Minister in charge of social innovation. Really happy to be sharing some thoughts with you on the HealthForAll platform, which is a virtual cross-border collaboration platform connecting the international healthcare ecosystem with industry leaders in Taiwan. As we know, COVID-19 has really been a catalyst for rapid shift within the healthcare delivery model. Each and everyone in Taiwan, part of the national counter-pandemic team of 23 million, really put together a social solidarity and social mobilization, resulting in, for example, the real-time visibility of mask supply and demand in pharmacies and later on in convenience stores, when people can innovate the rice cookers being used to disinfect the masks, and the fact that a cute spokesdog, Zong Chai, spread those health tips from the Central Epidemic Command Center, and also the story about the boy calling the toll-free number 1922, reporting that only pink medical mask has been rationed to him. He doesn't want to wear it to school. And the very next day, everybody in the CECC press conference wore pink medical mask. So the boy became the most hip boy in the class. And so all this is basically what we have observed in not only digital communication, but also manufacturing, such as the medical mask, the supply chain management, R&D, and the trusted pharmacies, the medical care community, and all the data that have accumulated provide startups. There's more than 140 startups based on the mask availability map alone, and with a wealth of growth opportunities. And so I would like to share the Taiwan's experience with such dominant industries, the digitally enabled industries, and we're uniquely positioned to drive innovation forward in the digital transformation of healthcare itself. And also, I would be remiss if I don't mention that there's a very large amount of established corporations in Taiwan, many of which publicly listed, that are actively looking for new avenues to innovate. And startups can also point their innovation in the health area into the right direction. So the single-payer national health insurance system, it covers more than 99.99% of not only citizens, but also residents. That's why we can rest assured that when you show up with your NHI card to a pharmacy or to a convenience store, you can always get the mask that you needed and without much fanfare, because the IC card reader is really ubiquitous. And also because people understand by law that those medical data stored in the National Health Insurance Card can only be used on public services. And so anything that we provide to the startup community is always in statistics form. But those statistics are invaluable because, for example, when people learned about the heat damage that this year is almost 40 Celsius degrees, such analysis showed that it's not only about the temperature, but also about the humidity, the direction of the wind, and also many other factors that altogether can predict more accurately whether someone will suffer from heat damage or not. And there's a presidential hackathon, an annual event where we honor 5 teams that use data collaboratives using such analysis and cutting-edge research to, for example, establish this app that encourage people to refill their bottles in the nearby, like Pokemon Go-like map. And not only this gamification makes people aware of the importance of keep hydrated, but also became the last mile in delivering such personalized high heat notifications, so that people in various different positions and various different works can stay ahead of the heat damage that may damage their health. And it also enabled families to care to each other, and that also drives community and social sector-based collaborative data joint ownership. And so the best way for startups to leverage this is just to make sure that it delivers a social good. Once there is a social good and the data management, the controllership is shared with the user community, then users are not just users anymore, but can become active co-creators to your data collaborative. Also, the rapid shift to digital technology for healthcare For example, for people in the 14 days quarantine with the digital fence and so on. Of course, we provide them with telehealth care, including mental health and so on. I think this trend will definitely continue, and people will choose telehealth by choice. Even after the COVID, because we never had a lockdown anyway here in Taiwan. We understand that the growth in telemedicine and telehealth and so on is because we have broadband as a human right, and people become more and more trusting of the relationship that they build online, because with fiber optics or with 5G, people can feel that they are in the same virtual space with co-presence much easier than the previous 3G or 4G models. And this is also why we allocated special fund in our forward-looking infrastructure plan as a result, for example, of our 5G auction spectrum mechanism design. We have a lot of money to put into telehealth for especially rural places that did not have a full utilization of fiber optics or 4G technology. And so to drive toward digital transformation in the healthcare initiative, I think it's most important to think beyond telemedicine, to think in telehealth, community health, public health. If even the epidemiology, a very specialized community can teach each and everyone in Taiwan through free online courses taught by VP at the time, Chen Jianren, the person who actually wrote the textbook on epidemiology, and spread through the spokesdog Zongchai into bite-sized chunks that enables everyone in Taiwan to have a cursory understanding of epidemiology. I'm sure that other essential health ideas of this current post-COVID situation can be spread into what we call the data and media competence education in both K-12 and lifelong education. So it's not just data and media literacy, which is about being consumers of data and narratives, but about co-producing useful data for the benefit of the whole society. And lastly, I would like to share some tips about cross-sector collaboration. I think it pays to understand the whole picture of the Sustainable Development Goals. We say Health for All, Taiwan can help, but we also say UN Global Goals, Taiwan can help. There's a lot of communities around, for example, circular economy, reducing plastic, taking care of life on land and below the water, and so on. And all these communities in Taiwan have a lot of experience using, for example, what we call AIoT, assistive intelligence working on Internet of Things, and turn them into Internet of Beings through the likes of air boxes, water boxes, all those participatory sensing projects. If a healthcare project partners with these existing social sector workers, then you can mobilize a lot of people who care not only about each other's health, but about the health of the whole planet as well. And that allows you to tap into the SDG focused investment scene that is just about impact investing, not just return of investment investing. And that sort of patient capital impact investing is also a new horizon that I would encourage you all to pursue. And thank you for listening, and I wish you live long and prosper.